Hello everyone, I am Dr. Rahul Dubbaka, consultant gastroenterologist and hepatologist, Care Hospitals, Banjara Hills. Today we will be talking about a very common gastrointestinal symptom, that is excess flatulence, also called as gas, or sometimes the patient may also say that there is excessive bloating and frequent release of gas. So these are the various terms which can be interchanged when the patient tries to explain his condition. So every food material which we ingest, once it reaches the small intestine and the digestion process begins, the digestion process will cause a release of certain gases. But there are certain food materials, when they undergo the digestion process, there is an excessive release of gases. So what are the common food materials which can lead to excess intestinal gas? One is red meat, while the other things are pulses, cruciferous vegetables, that is cabbage, cauliflower, broccoli, beans. These kind of food material can also, when they are digested, can lead to excess intestinal gas. Apart from this, regular alcohol intake or smoking or also carbonated beverages, these can also lead to excess production of intestinal gas. And if the patient is obese, or if the patient is having certain risk factors such as diabetes or hypothyroidism, in these patients also, because there is a slowing of the intestinal movement, there is a condition which is called as small intestinal bacterial overgrowth, which is common in diabetic patients and thyroid patients, wherein there is an excess intestinal gas production. So also, if the patient there is no significant physical activity, and if the patient has to work long hours sitting at a desk or at a computer table, because of the long duration of immobility also, it can lead to excess intestinal gas production. So if the patient presents to us with these kind of symptoms, first we have to see what is the cause for the excess intestinal gas. If the patient is consuming alcohol, smoking, or excess carbonated beverages, or also these artificial sweeteners, we should ask the patient to avoid these kind of food material, and also this smoking and alcohol. And also, if the patient is a diabetic patient and thyroid patients, if there are other symptoms which are suggestive of small intestinal bacterial overgrowth, treating the condition for a period of 10 to 14 days will also lead to reduction in the intestinal gas production. So, and also if the patient is overweight, or if the patient is having poor physical activity, improving the physical activity, say minimum of 30 to 35 minutes of daily aerobic exercise for at least 5 times in a week, and also trying to reduce the weight gradually, these also can help in reducing the intestinal gas production. Thank you.